Mary's a well-loved person in this town, and the whole town wants to help. We're just the tip of the iceberg. We represent the hands of hundreds of people that would love to be helping you, Mary. And it's important to bring that message. And then the other way around, Mary and I intend to change the world, one massage at a time. Better get that message. We're serious. This woman is a serious, organized person, and she is hell-bent to make a difference. And we have young people massaging Mary that have turned their lives around by just the experience of massaging her and learning what to do and being able to come and be in Mary's home and meet her family, be integrated into her community. And we have friends that have been lifelong friends of Mary's that know that this is not an antidote to their grieving, but it's going to really, really help in the aftermath of being able to remember their friend in such a hands-on way. And then we're going to go down the arm. So again, we can do the alternate thumb kneading here. And again, we're going to open up the circulation by doing the shoulder first. And we can just pop this particular outfit up. And then you can wrap your fingers all around. Good. Even though Mary doesn't move her arms, it feels good, right? Yeah. Well, you know what? Hey, let's use some oil. Mary, can we use you for the oil holder? Yes. There we go. She's got such lovely skin. And again, one of our focal points will be elbows for pressure points, for avoiding pressure sores. So all of the thumb kneading. Hey, that thumb kneading.
Little ones?
Yes.
Yeah.
And you can also open it up and do 1, 2, yes. Right, left, right, left. Yes. Very good.
Yeah, doesn't
No, it doesn't. But it's doing a lot better than it was half hour ago.
Okay.
Okay. Oh, you're nice and warm. Feel how cool my arm is? It's warming up with you. My warmth and inspiration here. It's nice to feel you touching me, Mary. I should do this all the time. It's neat. And you can feel with your fingers too, right? It's nice. Well, I think I'll emphasize that with people whose hands can't move, you know, to be able to put them on somebody. That's really nice. Now, what I do out here at Mary's elbow, Elaine, is a little awkward because I'll do little tiny thumb kneadings all around the elbow itself. Yeah. Have some more oil. Coconut. And all around there. Nice. And then we can do it with the palm of our hand like this too. Great. Okay, and then we kind of go up and down.
Okay.
So we're going to stand. And we're going to have, yeah, there we go. And again, we can get some coconut oil on. And this alternate thumb knead. You might want an aerial one for this, Tabby. Okay, now you can stand up.
Okay.
Because her arm will lift up.
Oh, okay.
Yeah.
Okay.
And then, again, alternate thumb kneading.
Not too big.
And let me show you something that's easy too, is hold on with the wrist and then with one thumb. There you go. And you can be quite firm, Elaine.
Okay,
I
I'm
think you're a
being gentle.
little wussy. So don't be afraid to be firm.
Okay.
Let me get my hands on.
Is that
Great.
pressure okay?
And then you get your hands on mine, okay? And then we're doing little, so right on the tip of your thumbs, little tiny strokes.
Okay.
And then as you bend the wrist like this, you can still do little tiny strokes.
Okay.
Doesn't that feel great, Mary? And the same thing, Melissa, if you bend up more like that. So again, Mary's hands are often like this, but by giving them that motion and having them bent, that really does help the circulation. And you can lift it up even more, so you get that postural drainage of the limb up, and then great. And then you can move right into the top of the hand. You know, and you can move your body back. And Nick, you've got strong legs, but I would suggest lean against the bed because it gives you more support, you know. And thumb kneading again, right into the palm. Nice work. Don't be afraid to be firm. You really want to get the circulation moving. And she's so well rubbed that you don't have to worry about. It's more sudden movements where I make mistakes. You know, I'll move something before it's warmed up. Okay, so let's do the corkscrewing of each finger. Yes. And then I stabilize it right at the base here, there, and then corkscrew with the other one. You are a good person to remember things. Middle one is up for grabs.
Up for grabs.
Doesn't matter which way you go.
Mix it up.
And it really is good to have lots of oil here because sometimes it's at the very end of Mary's extremity and the circulation is compromised because she isn't moving it around. So you can really, that's lovely. Yeah. And right out. And Lila takes such good care of Mary's nails. They're
beautiful.
Aren't they?
Yeah.
Okay. And then we're going to do the palm like this. And we can lift a bit. How are we for lifting, Mary? Because if we lift, it also mobilizes her shoulder. So gently bring it up a bit more so you're straight. There we go. And then we can work. I'm a little higher than you. Come on up. You can hold. There you go.
Okay.
There you go.
Gotcha.
And then the thumb kneading right in the palm. So even though there's a lot of muscle wasting, and this is a very classic situation with ALS, the muscle wasting happened first in your arms, right, Mare? That's what we were first massaging, was Mary's arms. And that's where she noticed the most change with the disease. Yeah, it's just lovely. Let me show you what that feels like on you, Lorraine, because it's just such a cool stroke. So it's like this. Isn't that neat? And you get all into the base of the fingers. And especially here, it just feels so good to get all this aspect done, you know. The top here doesn't have much meat on it.
Oh, okay.
But you know, this is, and this is where Mary's had a lot of the muscle wasting here.
Okay.
You know, that was one of the first areas, right, Mary? Was where she felt the muscles disappearing, were to do with her hands.
Okay. Okay.
You know, and so where we got a lot of bulk here,
yes,
you know, just pretend she's still got it,
right?
Because it feels so good.
Okay.
Yeah.
Okay.
And that these are the attachments for all what's here in the forearm.
Yeah.
And we just don't want it to keep getting tighter and fixed.
Okay.
Because the tendency, if she wasn't getting so much massage, is it would just become more claw-like.
Yeah.
And we're trying to keep it nice and loose and everything moving. So even though she doesn't move her arms anymore, the more that we can get each joint moving and massage, the better. Good work, Elaine. And then we can put it down. And we rest it on the bear. She's got a really nice position here for keeping the curve. And then the effleurage up, right to the shoulder, and we can just glide back without pressure. Okay.
Kind of like what?
I'm going like that.
Oh, okay. Okay, probably more than I am. Okay.
And like leaning with your stance again, one foot in front of the other. Yeah.
And you come down lightly?
Yeah, just kind of gliding down.
Okay.
It's better than just going like that. Right, Mary?
Right, okay. So like stopping. Okay.
Yeah. And that's good posture, the way Melissa's got a knee up and you've got that leg forward.
Okay.
That's fantastic because you'll lean onto your hands with your body weight, which is great. She looks pretty innocent, but she takes quite good pressure.
Right.
She's used to it. So.
Well, once we were talking, we had the TV on or something. We were in the living room and I was gabbing away. And I hear these grunts and I didn't even look up. I'm focusing on what I'm doing and I'm talking a mile a minute. I've taken over her role of talking a mile a minute. And she's trying to tell me, ow, like I'm going way too hard because I wasn't focused on what I was doing. I was focused on the story I was trying to tell her. And
well, you're the only one that's got the high sign for two rack.
okay, yeah, I did it
right
on her leg. Okay.
Oh, actually, I had one of those too, about the legs. That's okay. If you face her,
Yes.
then it makes more sense, and it's just a matter of doing a 8 on its side, which is just a bit different than just going around in circles in one direction and circles the other direction.
Which I could do
Just-
if I lose this whole figure eight
Totally.
concept.
Yeah.
Okay.
You don't have
Oh,
to do
that's
the
what I was
figure eight.
doing
Okay.
We'll take
okay.
zeros
You'll
too.
take zeros are good. I can
Zeros
do
or 8s. But it's just that kind of loop-de-loop. And the whole thing is just when you do the rhythm, it's not like you really have to understand it, but your body will remember how to do that.
Okay.
Looks like she's dancing there.
I think you're conducting the choir, Mary. You're going to have to show the choir. They were asking me, when do we get to see it? And so, that's great.